What's up, guys? Hey, Jared Beckstrand here, Doctor of Physical Therapy, ToneAndTighten.com, and today I wanted to share with you 6 of my favorite exercises that you can do at home to treat that pain that you might be experiencing in your upper back. Let's get into it right now. Alright, you guys, hey, thanks so much for joining me today here on Tone and Tighten. I'm excited you're here. I'm excited to be able to share a little bit of what I know with you, hopefully to be able to help you out with some of that pain that you might be experiencing. I'm excited that you're here. Quick plug for the channel. If you haven't done so already, I hope you take this chance to subscribe to Tone and Tighten. Hit that red subscribe button down below. My goal is to share information with you guys to help you to become the fittest, healthiest versions of yourself. If you haven't done so already, take the chance to subscribe to this channel. Also, if you find this video useful, hit that thumbs up button down below. Okay, so let's talk about upper back pain. Now, it's important that I mention to you guys 2 kind of principles that are going to apply when we're talking about spine pain, but especially when we're talking about upper back and thoracic spine pain in general. Now, our spines are pretty miraculous structures, really. They're designed to be not only very mobile, they have to go through a high degree of mobility. There's a lot of movement that's involved, especially at each individual vertebral segment. Motion at each segment adds up over the length of the whole spinal column to make it a very mobile structure. That's how we can move and bend and twist and do all the motions that we can at our thoracic spine. So if we think of a continuum, at one end we have mobility. Now, the other end of the continuum is stability, meaning that that column, it's prone to injury, and there's a lot that can go wrong with it if there's not a stabilizing force that's associated with it. So when we talk about stability, a lot of times we associate that with strength. The stronger the muscles, the more stable this column becomes. And so again, if we think about our continuum, we've got stability and strength on one end, we've got mobility on the other. And a lot of times what happens when I see patients, and especially this upper back pain, basically from your neck to your lower back, between your shoulder blades, when I get these patients into my clinic, a lot of the time they kind of fit into maybe one of 2 categories. They're either super mobile and not very strong, or they're super stable, meaning there's not a lot of mobility going on, and that's what we need to work on. And so what I wanted to share with you today are 3 of my favorite exercises to improve your mobility. So first line of defense is we've just got to get those vertebral bodies moving. We've got to get those joints mobile. If they're stuck, if they're frozen, a lot of times that's going to result in a significant amount of pain. And so I wanted to share with you guys some of my favorite mobility exercises to get those vertebrae moving. But then on the opposite end of the spectrum, if it is a strength issue, if you're weak through those muscles, especially the muscles that support your vertebrae, if you have weakness in those areas, that can be a contributing factor to that pain as well. And so wherever you find yourself on this spectrum, your goal is to kind of find that just right balance of I've got enough motion, but I've got enough strength, or I've got enough strength, but now I'm working on motion in order to make that a normal system, a normal, healthy, pain-free system. So that's what I wanted to share with you guys today. Let's get into it again. So I'm going to share about 3 of my favorite mobility exercises for that thoracic spine. We'll follow that up with 3 of my favorite stability exercises for that thoracic spine, and hopefully help you guys out, hopefully help you feel better along the way. Let's get into it right now. Extraordinaire. My wife, my lovely assistant, is going to help me to show you guys these exercises. First, we're going to demonstrate the thoracic mobility exercises. So these are the stretches and the mobilizations. They're going to help you guys to move a little bit better. Then we'll jump into the strengthening and stabilization exercises. So my first go-to is going to be what we'd call a thoracic rotation stretch. Right now, Camille's laying down on her right side. The first step with this is that I want her to bring her knees up as high as she can. It's important to note that with this one, the higher you bring your knees, the higher you're going to feel the stretch. What that does is that basically serves to kind of lock out her lower back. We don't want the rotation to occur here. We want it to occur right up here where it's stuck or where it's painful. So the higher she bends her knees, the higher she's going to feel this stretch. Right now she's laying on her right side, so with her right hand she's going to control this top knee. Right hand is right there to hold that down. Left hand grabs a big handful of ribs, and then what she's going to do is rotate towards you guys, so that left shoulder is going to come down towards the floor, and you can see right there, lower back is still straight up and down, but she's getting a lot of rotation right through that upper back. She's going to hold that for 15 to 20 seconds, and then come up out of it. Now, if you need something a little more intense than that, if you can tolerate that, if you want to take that next level, what she's going to do now, same position, nothing changes, she's going to rotate out of it, but now with this hand, I want her to actually reach back, kind of let it fall down towards the table, or towards the floor, whatever you might be on. Now all of a sudden we've got the weight of her entire arm that's actually facilitating that stretch, making that stretch a little deeper, a little more aggressive. If you can tolerate it, that's what I prefer to go to, and then come right back up out of it. And again, 15 to 20 second holds. She's going to do that 3 times. Right now, she's laying on her right side, she's stretching to the left, she's going to roll over, lay on her left side, stretch to the right. 3 times, 20 seconds on each one of those. Let's get into the next one. All right, and mobility exercise number 2 is going to be some thoracic extensions over the back of a chair. First things first, so I've got Camille seated in a chair right here. I want something that's sturdy. I don't want it to be on wheels, and I don't want it to swivel. Safety first with this, because you're going to be leaning back over the chair, so I want something with 4 sturdy legs on it, not anything that's going to move. So safety first. Okay, so what Camille's going to do, she's seated in this nice sturdy chair, she's going to place her hands back behind her head, and now what she's going to do is extend backwards over the chair until she gets a nice stretch through her back, a nice mobilization. A lot of people actually get a few pops and cracks with this one. If you're super stiff through your back, this is a great exercise to do kind of that self-mobilization to it. Hold for about 3 to 5 seconds and then come back up out of it. You'll see that she's hinging over that chair right about in this spot right here. So to demonstrate what that looks like, if again, here's the part of your back that we're concerned about, right now she's got a block happening right here where she's extending back over the chair right at that point. Now what we can do is we can vary where that block occurs to kind of change where you're feeling this mobilization and where you're feeling this stretch. How she's going to do that, don't fall, there we go, is she just slides her butt forward just a little bit, lean back against the chair again, hands go back behind the head, and now as she extends over that, again, we've moved where that block occurs, helps her to mobilize a little bit higher. So with the chair, you can go higher or lower depending on where your specific individual needs are. What I usually tell people is just kind of go up and down the whole back, kind of hit, 3 or 4 different vertebral levels, hold it for 3 to 5 seconds until you get that mobilization effect that's occurred. So there is mobility exercise number 2. Our last thoracic mobility exercise is going to be probably one of my favorites, down here on the ground with a foam roller. If you don't have one of these, I do recommend that you pick one up. Between my wife and I, we're on ours every day almost. It's just a great tool to improve your mobility. I will leave a link down in the description to one that I like. Go ahead and check that out if you don't have one. If you're a member at a gym, a lot of gyms will have one of these. Yoga studios, Pilates studios, you can find them around if you don't have one. And so we're going to do some thoracic mobilizations with this. Camille's go ahead and lay down on her back. You'll see I've got the foam roll perpendicular to her spine. She's going to reach up behind her head just to support her head. Now, the problem that I see when most people do this, and we kind of ran through that right before we pushed play on the camera, if Camille really supports her head and neck and then do it the wrong way. So you're going to hold your head and neck up and then roll on it. And so you'll see here, she's bracing her abs, she's using her arms to really support and stabilize. Basically, there's no mobility, there's no mobilization going on in her thoracic spine at all. What she actually needs to do is extend through her back, so now she's relaxed, she's not contracting her abs, she's not bracing with her head, and now as she pushes forward on that foam roller towards me, her head's actually going to fall down towards the floor, just like that. There, that's what it is. And so she's going to come up, and we're going to actually mobilize. And so now we get extension going. And again, as we roll that foam roll up and down, we're mobilizing at each vertebral segment. Don't brace against this. Let it mobilize. Let it push on your back. Let your back extend over that foam roller as you're coming up and down. When I give this to patients, I'll usually just set a timer. I'll set like a 60-second timer and say go for that amount of time. If you want to roll up and down about 10 to 15 times, should take about 60 seconds. Those are the numbers that we're shooting for. And so those are your 3 mobility exercises for your thoracic spine. Let's jump into a few stability and strength training exercises that are going to stabilize that area. All right, so our first strength or stability exercise, we're going to grab some bands, or we're going to jump onto a cable or pulley machine at the gym, and we're going to do some rows. And so Camille's got, her hands are straight out in front of her. What she's going to do is brace her core and then pull both of her hands back into her elbows, and then right back down. With this, what I'll tell people is I want the motion to occur from your back, meaning it's really easy to kind of sit here and contract your biceps, but you'll see with Camille, I want the elbows all the way back behind you, and I want your shoulder blades to squeeze together every contraction. And so she's really making that emphasis. We're really trying to activate those muscles that are going to support and stabilize your thoracic spine as she pulls those muscles back together. Now, to take this next level, we can actually introduce a little bit of mobility with this stability exercise. So to do that, she's going to do just a single arm row. And so as she pulls, you'll see that I'm also having her kind of open up. So she's going to pull with her right hand. She's going to open up towards you guys. We're actually introducing some rotation through that thoracic spine in addition to the strength. And so we're actually kicking on one more group of muscles. She's pulling with, again, that scapular stabilizer muscle, but then we're also doing some core rotation and some thoracic rotation with this as well. And so typically what I recommend to people is 3 sets of 10 regular rows or 3 sets of 10 on each side, single arm rows. There's your first stability exercise. Your second stability exercise is going to be what I refer to as a wall angel. Just a great way, it doesn't require any equipment, and it's a great way that you can get, again, those muscles between your shoulder blades and that support your thoracic spine really active. So Camille's up against the wall. I tell people I want your butt, your shoulder blades, and the back of your head against the wall. Your feet can come out from the wall about 8 to 10 inches, makes it a little bit easier. Now, in this position, I want her knuckles back against the wall. If you kind of have a poor posture, if you kind of have a rounded shoulder posture going on, this can be really difficult to get into that. So that's why I put you up against the wall, is to get up into this extended position. So again, butt, shoulder blades, back of her head are against the wall, knuckles come to the wall. And so I know I've got a ton of really good scapular activation going on in there to retract into this position. Now what she's going to do is slide her knuckles up and over her head and then right back down. Now, in my physical therapy clinic, what I like to do is just set a 1 and even 2 minute timer with this. You'll see that the first couple of reps, you're like, oh, I can do this all day. But by rep, 30, 40, 50, it starts to really get fatiguing. You start to really feel it, again, in those muscles that are going to support your thoracic spine or your upper back as we go up and down. It's a great way that we can strengthen and stabilize those muscles. You're going to like this one. There's exercise number 2. So our last exercise that's going to improve strength and stability in that thoracic spine is going to be what we'd call a prone W. Called a W because of the motion that you're going to take your arms through, kind of looks like a W. Camille's laying down on her stomach, and what she's going to do is basically, I tell people, lift your chest up off of the floor, try to tuck your elbows into your back pockets. And so up she comes, and then the elbows come down and tuck into her back pockets, and then go ahead and come down. What I'm looking for is I want what we'd call a scapular retraction with this. And so it's a great exercise because you're getting extension through your thoracic spine. So we're getting a little bit of some motion as you extend backwards, but then we're also getting a ton of those interscapular muscles active with this one. Those scapular stabilizers are going to go crazy with this as well. So again, her chest comes up off the table, tuck her elbows into her back pockets, squeeze your shoulder blades together, hold for a 2-second count, 3-second count, and then come back down out of it. Nice job. Or a 5 or 10-second count, however long it takes me to explain. Let's do one more. So extend through the back, tuck into the back pocket, and then come right back out. Again, trying to squeeze the shoulder blades together is the important part of that. And so 3 sets of 10 reps is what I typically recommend with that one. And that's it, you guys. We're all done. I ran you through 3 of my favorite thoracic spine or upper back mobility exercises, and then 3 more of my favorite stability exercises. Hopefully, if you guys perform those exercises, they're going to help you out. They're going to help you with the pain. They're going to help you with, again, the strength or the mobility that you might need, and hopefully just help you guys to feel better. I hope you appreciated this video. I hope you enjoyed this content. If you do, go ahead and hit that thumbs up button down below. If you know anyone who might benefit from the stuff that I've shared in this video, there's also a share button down there that you can post it to either your or their social media pages. Go ahead and check that out. If you have any questions or comments, be sure to leave those down below. I'll get to those as soon as I can. One more plug, subscribe to the channel if you haven't done so already. And that's all from me, you guys. We'll see you right back here next time on Tone and Tighten.